So we talked about trial results that have been reported in the last several years. These include the NETTER-1 study, which randomized patients to receive lutetium dotatate versus high-dose octreotide in patients with progressive midgut neuroendocrine tumors. We talked about the TELESTAR trial, which randomized patients with diarrhea related to carcinoid syndrome to receive several doses of telotrestat versus placebo and showed a significant improvement in diarrhea as well as reduction in urine 5-HIA. We discussed the RADIANT trials, which proved the role of everolimus both in pancreatic and non-pancreatic neuroendocrine tumors. As far as currently accruing clinical trials, I think there are several that are interesting. One is ECOG 2211, which is looking at temozolomide capecitabine versus temozolomide monotherapy in patients with progressive pancreatic NETs. It's a very exciting trial because there have been a lot of small retrospective studies, a few subsets of prospective studies looking at temozolomide-based combinations, but very little in terms of robust prospective clinical trials. And this is going to be a very important one to help figure out whether combination is better than monotherapy. We're looking forward to results of a pazopanib versus placebo trial in non-pancreatic neuroendocrine tumors. If positive, this will be the first angiogenic inhibitor to be used outside of pancreatic NETs, in other words, in carcinoid tumors. There's an interesting trial that's not yet completed accrual looking at streptozotocin-based chemotherapy versus everolimus in patients with pancreatic NETs, trying to get at the whole sequencing question. And then there's some trials that are just starting out looking at immunotherapy, which really hasn't been well investigated in this field.